Hello everyone, how are we doing today? Welcome to the Masters of Public Health webinar. So today we are going to go over the Masters of Public Health program. It is a fully online program here at the University of New England, and we'll go ahead and get started shortly. We're going to go ahead and wait a couple more minutes just to make sure that we don't have anybody coming on, and we'll get going here. All right, folks, looks like we're ready to get started. So we'll go ahead and kind of get this going here. So my name's Joseph Jenkins. I work on the online worldwide learning program here with the University of New England, here with the Masters of Public Health program. And I'm accompanied by Denise. Are you there with us, Denise?
Yes, I'm here, Denise Bisaillon.
Beautiful. And Denise is the program director for the Master of Public Health online program here at the university. So we'll go ahead and start discussing the program a bit. So we're here to discuss the Master of Public Health program here at the University of New England. So the mission of the graduate programs here in public health, as you can see, is to improve the health and promote the well-being of individuals, families, and communities through education, research, and service. We're definitely dedicated to this here at the University of New England, and look forward to individuals that share this very same passion as we do. So this is the program at a glance. These are some of the professors, and of course Denise is on here, the program director. It is a great faculty. I would kind of like Denise to maybe speak about this a little bit, as you know the faculty very well.
I'd love to. As you can see, we have people who have clinical backgrounds. We need to update this because we've added some people. For instance, Michelle Polisek has a background, she's a PhD from Johns Hopkins, and has a background in looking at obesity issues, nutrition, and exercise. Praful Joshi, who we'll come back to, is actually got his first degree as a dentist in India, and then came to this country and got an MPH and then a PhD from South Carolina, the Norman Arnold School of Public Health at the University of South Carolina. Karen O'Rourke on the lower right-hand corner is overseeing our practical experience, which is part of the Practicum, and she's got an MPH. Ron Duprez is nationally known. He has a PhD from Rutgers and an MPH from Harvard. He oversees the research component here at the School of Public Health. Oh, that's another thing. We're not just a program. We're now a school of community and population health, but we haven't changed over our name yet. That just happened with our last board of trustees meeting in May, but you'll see that as we move forward in our on our website and in our materials, program materials. So Ron, Dr. Duprez really looks at program evaluation and is very expert in the areas of the Accountable Care Act and health policy and planning. Also to highlight Jen Lee Morgan, and Dr. Morgan now is the interim director of the nursing program, but she also, as you can see, has the MPH, and she heads the Ghana cultural immersion mission, which we'll talk about in a minute. So back to Praful, we try to highlight a faculty member each time we do this, and now it's Dr. Josie's turn. And as I said, he received his MPH and a PhD in the Department of Health Promotion, Education, and Behavior at the School of Public Health at the University of South Carolina. And he's very much focused on nutrition and physical activity, also oral health, and the efficacy of certain diets and physical exercise for school-age children. One publication that he just did with another author was the relationship between fitness levels and academic performance that he did with some schools when he was in South Carolina in that one. Before he came to the university here, he was at an assistant professor at the University of Louisiana in Lafayette, and we're very lucky to have him. So he is very well published in state publications, international publications, and obviously professional journals, and has presented in a variety of venues. The American Public Health Association, he presents almost every year, and the International Conference on Violence, Abuse, and Trauma. He also works with I'm just trying to check on that latest one that he, best practices for school violence prevention in safe schools, and he also does national technology and social science conferences. So we really are lucky to have him. He's one of our newest faculty members to join us, and you'll have an opportunity sometime to chat or meet with him if you come to our program.
Beautiful, beautiful. Thank you very much, Denise. So we'll kind of keep moving right along. So the next thing we were going to discuss is the accreditations that we carry here at the Master of Public Health program at the university. We are CEEF accredited, the Council on Education for Public Health, and also NEASC. So we're both CEEF accredited and regionally accredited, which are both important depending on what you would choose to do with your degree and moving forward in your career. Is there anything you'd like to discuss on these, Denise?
Well, we were one of the first. We were about, I think, the third program to be an online program to be accredited by CEEF, and we're very proud of that. We have quality programs quality courses that we're now looking at getting certified in what they call Quality Matters standards. So we're educating our faculty in terms of Quality Matters, which is a peer review group that has standards and has items to evaluate your courses and sections of the courses. So we're very focused on that because we want to ensure that not only our course design, but that the standards put forth by Quality Matters are met.
Beautiful, beautiful. So we'll continue to move forward. Public health education. This is a question we get quite a bit, is what kind of career opportunities are available after earning an MPH degree? There's quite a vast, from my understanding of it. Now, Denise, did you want to kind of touch base on some specific ones that you would
Sure.
like to share?
Yeah, people who are calling in today, I think you will have a sense of how broad public health is. And this is an MPH that is a generalist degree, and you can focus in on a specific area with your practicum and some of your electives. So you can focus, you can kind of tailor it at the end for what your particular interests are. This degree enables you to walk into a lot of arenas, and some of them are, you know, in terms of policy advisors, working in nonprofit agencies or professional organizations as either a legislative policy advisor or maybe an academic or management policy advisor. You can work with epidemiological groups, perhaps at your state public health level, or again with other government or small agencies that are looking at either research, also pharmaceutical epidemiology is another growing area. Some people focus on behavioral sciences and want to be health educators or behavior scientists in these organizations. Health communications is a area that's booming as well, and you could be a communication specialist or journalist, web journalist, for instance. Occupational safety and health is a huge area, along with environmental health, and there are many state, federal, and local positions that an MPH would be an excellent additive. And there's, of course, international or global health, and there are myriad positions out there that look at global health issues. And this can be your local agencies that have a global perspective, or actually going abroad to international positions. Then there's, of course, the public health preparedness and emergency preparedness positions that, you know, you might work with a state lab, you might work with local police or first responder agencies. There's oral health, as I mentioned before, and a variety of other family health and community health positions.
Beautiful, beautiful. So with this generalist degree, it kind of gives the people the opportunity to find, you know, where they would like to go with it?
Yes. I mean, some people might go on to get other degrees, or some people may have degrees already, such as nursing or PA, or that could be in education already as a teacher, and they want the MPH as an additional set of skills so that they can either be promoted or kind of move into a new area using their skill sets from their first position. There are lots of different ways that an MPH can be used. Some people, we have some students who are doing dual degrees. They may be in a PT or nursing or medical program, and they're sandwiching the MPH in their schedule. So most of our students are doing other things. They're either working full-time, and the majority are working professionals, or there's that subset that are students in other areas and they want the additional MPH. Also, there are some people who want to get the MPH as a way to leverage themselves in applying to, like, medical school or a PA program or pharmacy or dental school, and they feel like that gives them the edge when competing to get into those programs.
Beautiful. So that kind of brings us right into our next topic. We were going to discuss some of the program details, some of the specifics on the program itself. So here with our Master of Public Health program, this is a 100% online program. There are no campus visits required, although we do recommend and encourage individuals who want to come out here and see the pretty coast of Maine. You know, we're here on campus, more than willing to visit with you if you ever want to come down, and we always recommend folks do if they choose to. It is quite a beautiful campus. We do have 2 locations up here to visit, and the one in Bedford on the Water is very, very beautiful. So anybody, you folks that would like to, please feel free to do so. It is set up in an asynchronous online format. We use the Blackboard learning management system, So essentially students can log in as they see fit with their time schedule. So we have individuals in this program that work different schedules, their times are different. We even have folks in different time zones and different countries, frankly. So it allows you to work at your time, which is great and very much so needed in today's environment. So kind of the way the classroom was, you would have textbooks, you would use the learning management systems via Blackboard, multimedia, and then supplemental readings throughout the program. And then we do use a lot of virtual stuff, discussion books. Case studies is going to be a large format, emails, quizzes, tests, and then group projects and discussions. Denise, did you have anything on that you would like to add in terms of the group discussions, or do we have things like that going on in there?
Well, we really try to design our courses for optimal student engagement. And obviously as technology improves, it's gotten better and better over the years. And the Blackboard learning management system has also improved over the years. So it's something that's always ongoing. There's, you can take a snapshot at any time. But right now we're really encouraging faculty to use all different kinds of learning materials. So it could be visual and auditory, and we're not tactile yet, but who knows, 10 years from now it might be. But, to use multimedia so that you can discuss and understand a concept or particular problem set in a variety of ways. And the discussion boards are great because it gives students the opportunity to read, the material, textbooks, articles, and whatever else the professor might upload. Listen to lectures if they have lectures, or other lectures from outside, maybe a YouTube or a TED speech, and understand it from these different dimensions, and then talk about it. And oftentimes it's focused, or what they would call forum questions, and students can discuss what they think is going on, and address the question posed to them, and then talk to their peers about it and critique their peers' comments. My favorite is case studies, and I'm hoping that a lot of faculty will adopt that. My course is all case studies, and I think that that's a great way to analyze concepts that students are confronted with in their texts and their other materials, and so that they can look at the problems and analyze them according to these new notions.
Beautiful, beautiful. So that kind of rolls us right into our next slide, and kind of goes into what a typical assignment, test, and/or paper would be, and how they flow in class, and then what they should expect for what students should expect for a workload in terms of how many hours a week, fully dedicated to both classwork, studies, self-study, and performing the necessary tasks to complete the course.
Mm-hmm. Well, example of a typical assignment would be what most people think of, which is a paper. Sometimes there are short papers just to really get a sense of a particular issue. Other times, some faculty require longer papers. We're pushing for shorter papers so that people can get into this quickly. The course is only 8 weeks long, every course, so it's nice to get some feedback right away. But there are others that will have maybe a longer paper at the end of the course at the 7th week or so. Some people do have tests, some faculty, usually quizzes, and there are other assignments like the discussion threads are given points, so that it's usually kind of a diverse group of assignments, so that it's not any one particular format. And how many hours really depends on the student, but I would say, given good, could go anywhere from 15 to 20 hours a week. Some people do less, some people do more, but I think given the amount of time, the fact it's only 8 weeks, and the amount of work that's put into that, you want to be on every single day. You don't want to lose a day. You log on, you see what's going on. Some days are more, if the assignment's not due, you're reading and you're processing that way rather than going in and uploading papers or doing any other assignment. But it's really advised that you log in every day, check out what's going on, check out the discussions, and read all the discussions.
Yes, agreed. I do hear, for the most part, a lot of students do say around 15 to 20 hours a week is a good, kind of a good block. Obviously, they do have some classes that are a little, some stronger in and some weaker in, but they say that that's a good average. One thing I would like to touch on is the assignments and the tests and the papers. Those are all typically submitted via Blackboard, correct?
Yes.
Beautiful. So we here at the university, we use the Blackboard system, and students upload papers, assignments, and tests through there, giving them the ability to do it on their own time frame without having to submit it in person, of course, or have to deal with the mail systems.
Right.
Beautiful, beautiful.
It's fairly easy, and we have a student orientation before the first course that students take, and it kind of walks people through that, what to expect on that level.
Beautiful. And that kind of brings us right into our next slide as we're talking about the program itself. A bit on the practical experience that students will go through, and then their capstone project.
Mm-hmm.
And then, go ahead, I'm sorry.
Go ahead. No, that's all right.
Basically, the two, and then the final one, and we do get a question quite often, is how do folks find their location for their practical experience. And I know we've had some great ability to do that for students here.
Right. So what we call this is the integrated practicum, and it's divided into 2 courses, and there are 2 credits each. So 4 courses make up the 4 credits make up the practicum, and the first 2 credits are for the practical experience. And that's going out into the community, into a situation where you're not working, where you're not, if you're in a public health situation, we want you to try another one, and separate from what you're doing now, to expand your perspective on public health. And typically it's, depending on where you are, there's some big noise going on in the background there. Typically what happens is a student will get a general idea of what they're interested in after taking some of the required courses. And they start formulating that idea about, oh, I think I'm very interested, for instance, in working maybe with my state Department of Health on immunization. And I want to work in a community agency that does immunization or analyzes immunization for that community. And so the student will approach their community organization and a person that is a possible preceptor, and ask them if they're willing to take on practical experience student. And then what will happen is our Karen O'Rourke, our coordinator for this, will talk to the preceptor and work with the student to get the forms all in place and set up a project. And oftentimes students will have their own project in mind, but when they go to the agency or organization, that person will say, well, that's great, but we really need somebody to do this, because they do have projects and they need the help. And so, it helps to just have an idea and then go speak with that potential preceptor about their needs. And it takes about, from the time of planning to the time of finishing something, some project, about 120 hours. That's what we, look at for this particular experience. And that does not mean sitting in an office somewhere for 120 hours. It means the whole project. A lot of it can be done online anytime, or at home, working on a computer. And the capstone is, we hope, integrated with that it is essentially a culminating experience of writing for instance, a lit review paper, where you go macro on it. You look at the larger world view on, if it's immunization, it would be, looking across, say, the country and what immunization issues there are. And what you want to do is tie in your community experience with this more intellectual, critical analysis. And we've had really great practical experiences where the students love it. Many of them turn into positions, turn into jobs, because they get to know people and they network, and it's been quite rewarding for many people. And the capstone is a nice project that we've highlighted too, that we've brought on webinars for people to hear, especially if they're kind of generic and not particular to one particular state, but we can also, finesse that as well. Do they have to be connected? No. Sometimes some people will say, I really want, I've finished my practical experience, but now I want to do this for my capstone project, and you're free to do that. We just think that it's a richer experience when they're tied. And the location, again, it really depends where the student wants to do this. So the student will say to us, I live in South Carolina, or I live in Arizona, or wherever they live, and this is what's available to me, what I could actually go to and visit and work with. Or they see, they might work with their Department of Public Health, which might not be local, but they can do a project that virtually and still work with them and just maybe meet with them once or twice. So there are a lot of possibilities, but we try to focus it on where the student wants to be and talk to them about the opportunities.
So awesome. So that kind of brings us right into our next topic, which is basically the program structure. And we've kind of been discussing that a little bit, Denise. So the master's degree is a 46 credit hour program, a total of 16 courses at 3 credits apiece. And our certificate program would be an 18 credit program with the 6 courses, 3 credits apiece. The courses are set up in 8-week sessions, so any one course you would go through kind of a condensed 8-week session. And then so that it's broken into 3 separate terms, and then each term you would have 2 of these 8-week sessions, and I have kind of a diagram we'll go over in a second that may help you folks out with that. And in this program we do have the ability to do a double course load, which can be done in about 1 year, or the standard model, which would be about a 2.5-year full-time study. And that's the term set up, and we'll move right into the next slide. So this is how our typical terms are set up. As you can see, if you were an individual who started in the summer term, and we have the ability to start folks in all 3 terms, which is great. So if you started in the summer term, you can see right there in session A, you would take 8 weeks of the 714 course. Once that 8 weeks is over, you would roll right into the session B program for 8 weeks, B in 722, and kind of continue on that 8-week model with breaks in between the separate terms, kind of accordingly. So it's a nice flow, and it is, Denise, definitely set up for someone who is a working individual, correct?
Yes, And I'm looking at this calendar, and it's not the current year. So what happened, I think, was we used last year's calendar. So if people go on our website and they see 2013-14, and it's not this one, it's because I think it was last year's. But
yes, you're right. I apologize. This is a...
No, it's good for a model just to look at and to see the different colors that, okay, there are 2 sessions in every term, so there are 6 sessions across the year. Now, a working professional typically would take that GPH 714, like if they started in the summer. If they start in the fall, they would take it. It's offered 3 times a year. They would start that in whichever term they start. So let's just follow a summer term. So that person takes that, and then for the next course would be Session B. They would take GPH 722 because that's a required course. All these little red, R's and C's are requirements. Required for a core course, which is also required. And then if you go using this, you would go through 6 sessions. So you'd say environmental health, then you would take in fall Session A, policy and management, fall Session B, social and behavioral health, spring Session B, research methods, Session A, spring Session B, epidemiology, principles of epi, and then the following summer, the first term would be biostats, and then you would have all of your requirements completed, and then you would proceed to take your electives. And we'll actually we're adding electives for this year, and we're adding next year, so there'll be even more choices. You'll take 7 courses that are electives. And then when you're done, you'll be planning way before you're done with all the coursework. But when you are done, you will go into the integrated practicum. And some students take both courses at the same time. Some stretch it out. But you'll see that it's not just an 8-week slot. It's 16 weeks. It's the whole term. So you'll have 16 weeks to do the practical experience. And then, again, you can split it up and do the capstone experience for the next term. Or you can double up. Some people do if they have the time to allot that.
So this program is very much so set up that you're never taking more than 1 class at a given time, kind of giving the students the ability to focus on that given course.
Yes, except if they do want to accelerate, as you had the other slide, they can take more than 1 course during a session. But I want to, what we do is we advise them, we talk with them, we'll have mentors, and make sure that it's okay. You could take a look at the syllabi before you do this so that you know it's okay. And I would only recommend that for somebody who's doing very little work, like part-time work would have to be very part-time, or that they have some space if they're doing a dual degree that has been allotted to the MPH.
Okay. And that kind of moves us into what we were discussing briefly a second ago, the difference between the core courses and some of your required courses. Then we have the electives. So did you want to go into this a bit, Denise, kind of the difference between the core courses and the required courses?
Well, yeah, the difference is a core course is using the language of, both the Association for Schools of Public Health and also the American Public Health Association. There are 5 core areas of knowledge in public health, and these courses represent those 5. Then on top of that, we have 2 required courses the program's requiring, and that's, you want to go back?
Sorry.
Yeah, Principles of Public Health, which we use as sort of an introduction, and then Research Methods, which we feel is a benefit for all of our students to understand research methodology and design. So that's why the 7 are required. And then you can start with your electives, and as you noticed, it's kind of a smattering all across those 5 course areas, and we'll continue to add. We're going to add, for instance, an infectious disease epidemiology course in the spring of this year, because we know that many students from surveys are interested in epidemiology. And we plan on also offering another one called health systems, healthcare systems, because of really what's going on in the country with the Affordable Care Act, and so to really understand how, the history of healthcare systems and where they are now. So those two I know we're offering, and we will be offering more in 2014-15.
Okay. Beautiful. And we'll move on to the next slide. So this discusses some of our costs and fees here at the university. So here in the Masters of Public Health program, it is $620 a credit hour. The complete master's program is 46 credit hours, like we discussed before, and the certificate is 18 credit hours. We do have some fees associated. There is the application fee, a general service fee, which is one time, and then the technology fee per semester, and then your standard books and materials. Denise, do you know what students should typically kind of allot or set aside for books in this program?
Well, that again varies. We have some people that will have one textbook. Others have no text. I mean, not many, but for instance, the professor that teaches biostatistics doesn't require a textbook. And a lot of people say, well, wait a minute, I have to have a textbook. So she'll make recommendations if you want it, but she provides all the materials because she's found in the past that many of the textbooks are not very user-friendly, and she would rather students approach the topic with without having to wade through textbooks that are not particularly easy to read or access or understand. So it really varies. My textbook for my course is expensive, and I really worry about that, so I try every year to find a better one, but I haven't, and it's, and that's not typical. Most textbooks are in, the kind of normal range. But what I do get feedback on mine is that people really like it as a resource, that they will use it and they don't want to sell it afterwards. So, it really depends on, the nature of the topic.
Beautiful. So in this program, if the individual professor feels that it's needed, they'll use it, and if it's something they don't necessarily need, they don't make the students have to do so, which is
right.
Which is great.
Yeah, I think it's average. It's probably, I don't know, anywhere from 100, probably around $100, 150 tops per course, and some don't have any, so, or they have paperbacks, and I guess I'm not supposed to say this. Don't go, people want to go through the bookstore, but there are those that go through other mechanisms like Amazon or, to try to cut down on the cost. The important thing to realize is that when you sign up for a course, to look at what edition it is, because it can make a big difference. Not to just go out and buy the book without understanding that professor is using the latest edition, which we usually require our professors to do.
Okay. So now we're going to kind of move on to one of my favorite parts of this program, the student support specialists that we have for these programs. So the student support specialist is someone who basically follows the student through the entirety of the program and is there during the entire process for anything that may come up for the student. And we always really try to stress to the students that anything that comes up at all, both personal, schooling, financial, anything that is going to affect your program moving forward, if you feel comfortable to do so, we always would recommend to bring it up to your student support specialist. And that way they can really kind of get in front of anything that may kind of come into a roadblock, or any situations you may have come up in your personal life that may need to be addressed. I think this is one of the greatest kind of things we have in terms of support. It's nice to have a singular point of contact for individuals, along with myself here, yourself, Denise, the program manager or director, but we do have a support staff in place specifically for students to contact for anything to come up. And I've seen some, great uses. You're having trouble signing into Blackboard and you're locked up because you forgot your password, to more important and pressing things, which I think is great. And Denise, did you want to touch on this at all?
Well, we're very happy with the structure that we have here, and the person that is the student support specialist has been absolutely wonderful, and students have appreciated and have said so. So I'm glad that we have this structure, and also she works closely with the Student Academic Success Center as well, and I think both services are really, really great for online programs, and it should be for on campus, but for online especially, because we're all over the country, and this helps to personalize, and I think all of us try to do that, to put a face on some of these positions and work closely with students.
Yes, definitely. It is nice to know that even though we are an online program, students and applicants, of course, do have a singular point of contact that you can reach out, and we'll try to do everything for you here on campus that we possibly can. So that kind of moves us right into our financial aid here at the university. We do find that more than 90% of our students use some form of our financial aid system here at the university. And we definitely do recommend individuals reach out. They do have a lot of financing programs and different packages and options, really depending on your specific set of needs and kind of your specific set of situation. So we would definitely always recommend individuals reach out. You're more than obviously happy to, or we're obviously more than happy to talk to you about it here on our enrollment level, but these folks here in the financial aid office are well versed, and they definitely do their best to find what would fit your specific sets of needs and or criteria. Anything you'd like to add into that, Denise, at all?
No, I'm great. Good job.
Beautiful. So folks, again, if you have any questions, please feel free to reach out to us on these, but financial aid is definitely going to have all the info that you would need, and hopefully we can do our best to find what works for you. So now we'll kind of move right on into the Student Association for Public Health. And Denise, I may have you kind of speak on this a little bit for me.
Sure. So this is the only online student association here at UNE, and we're very proud of it. We are in the process right now of trying to get the next panel of officers for the fall, and it's all done online, where there are nominations for the officers, and then they're elected, and the officers can call meetings using this kind of webinar. This is a go-to webinar, but we also have Blackboard Collaborate, which is very similar, and so that people can ask questions and participate and chat on various issues. They've done different things in the past. We've had, they brought in an expert on emergency preparedness to, talk about what that position was like for him, and what is entailed. So that was very well attended. And they've had, I think there was a lottery kind of raffle, so that textbooks were given, and it depends on the event, but this is really a nice way to network with your peers and to have an opportunity to talk with them without being in a course. So we can, the program will support this in any way possible, so that students have an opportunity to connect. And there are the positions are president, vice president, and then one called counselor, which is that person would participate in a monthly graduate council that's held at UNE via the phone, and then a treasurer / secretary.
Beautiful, thank you. So that moves us kind of some of the interprofessional activities that we do here. So here at the University of New England with the Master's of Public Health program, and actually I believe it's all public health programs, we have a Ghana immersion trip, which Denise, I'd really like for you to kind of speak on kind of what it entails and some of the
Sure.
experiences that individuals may have.
Sure, and it's not always all women like this, only a few men. I think it was that particular mission that there were more women there. But the Ghana immersion was started in the Westbrook College of Health Professions program through Jen Martin, and it has grown, so it is an interprofessional project where she goes twice a year, in March and in August, although this year she only has the August trip. And it's about, I think, 10 days to 2 weeks now. I'm not sure if they expanded to 2 weeks, but there are clinics set up, a health clinic in Ghana where the students can participate, and our public health students go and do public health projects rather than the clinic and help out with either analysis or setting up a database or whatever the needs are at that time. So usually the clinic is in the morning and from like 8 to 12, and they have all sorts of people that are lined up for the clinic. And then the afternoon is sort of free time to, explore the town and or to take little side trips. And it's been absolutely wonderful. People love it, and it's been, a life-changing experience. In fact, at our graduation hooding that we had this past month, the student speaker had gone to Ghana, and she just couldn't say enough about it. She's a teacher in high school, and she got her MPH so that she could set up more health programs for the community and for her students. But this really opened her eyes, and it was wonderful to hear her talk about it. So it's an opportunity, and you can get credit. Some people are, one person right now is doing their practicum in Ghana. So there are all different ways that it can be used, or it can just be enjoyed as an experience.
Beautiful, and it's not just Master of Public Health individuals that go on that trip, right? It's
oh no. It's nursing, dental hygiene, PAs, PT, OT. It's pharmacy now. We've got medical students going. It's truly an interprofessional, and social work. It's an interprofessional experience. So you're working with all sorts of professions that you will work with or be a part of when you go out into the communities or most organizations. And we want to build that notion of teams and how to work with other professions. And this is one way that is especially relevant.
Beautiful, and definitely in terms of future networking and networking out there, it's a great way for individuals to meet other folks that aren't necessarily in their specific field, which I think is great. Beautiful. Right. So that'll move us on to a kind of a quick alumni spotlight. This is Joe. Joe graduated class of 2009 and now works for the Maine CDC. He found that the practicum was highly instrumental in terms of getting him into kind of the best way for him to perform his job at the CDC, and used it quite a bit. Did you have anything you wanted to speak about Joe at all, Denise?
No, that's fine. I mean, some of these people they did enhance their situation, got promoted because of the MPH. But we have so many stories, so we
Yes, yes, we
might want
do.
to have a collage of the people, because I think you only have 2 Mainers, which, oh, well, she came from Einstein College of Medicine. That's good. That's a good one.
Yeah. So, and Carol, you're right. Came from Einstein College of Medicine, and she really was one of those individuals that was looking kind of to expand a current degree, like you discussed before,
Yeah.
which we do see quite a bit of folks kind of looking to expand their current degree or area of focus.
Right.
Beautiful. So here in our university system here at the Master of Public Health program, we do what we call rolling admissions. So once an individual has finished their application, the application packet is completed with all required materials, we can go ahead and submit that application right then and there, ideally giving you a decision within about a 2-week window, which is great, so that way folks don't have to wait till their application deadline. If you know you want to start, like this says here, in the fall, we could go get your application submitted as soon as possible, and you would know well in advance. Because of course, starting a master's degree, it is an intensive 2-year program. So it's nice to know in advance that exactly what day and when you'll be starting, and you don't kind of have to wait. So a lot of folks will see the spring term application. They know it's a little time out, but you can start working on something like that now and submit it now, so you know that when classes start in January, you're ready to go, which I think is great. A lot of students use that quite a bit. So opposed to waiting for the application deadline, they're able to have a decision before, which a lot of students find very, very helpful. So that'll move us into, so this is my contact information. Again, my name is Joe Jenkins. I'm an enrollment counselor here at the University of New England. I do work on the Portland campus, so you folks who would like to make it up here sometime, please come on up. I'd be glad and happy to show you around. That is my direct phone line here to my desk, and of course my email address, which you folks can always take down and ask any questions. I would definitely recommend asking any question. Please do. That's what I'm here for. And then we have some question and answers. So as we've been sitting here, folks, some of you folks have been kind of submitting questions. So kind of we'll go through, and Denise and I can kind of answer those, and hopefully if you folks come up with questions as we're going through, please feel free to submit. And I do have some questions here that kind of folks have already been going through. So if Denise, you're ready, we had a gentleman ask, in what ways can an MPH degree help a future physician?
Wow. Well, I could talk all day on that. Well, the MPH is population health. It really looks at populations and looks across, instead of one patient and zeroing in on the individual's health or particular health status. And I think that perspective really broadens the physician's understanding of what can be done in terms of prevention and health promotion. There's a wonderful film out that's called Escape Fire that Don Berwick and his folks just released this past winter, and it really talks about rescuing the healthcare system and how it's broken in many ways because we're so focused on chronic disease that costs are escalating. And I'm sure I'm not telling this physician anything new, but public health can give new tools, a set of tools to the clinician, physicians, nursing, wherever clinical field you're in, to redesign programs to promote health and limit the potential for chronic disease. And I think that's the first wonderful set of skills and tools that that are given through this kind of educational experience, and the perspective again, you know, helping develop this kind of more optimistic perspective of getting people in before, you know, something goes wrong or before there's a disease process going on.
Beautiful.
Now, on a personal level, it helps to have an MPH because people will see those credentials and see that there is that breadth and depth.
Okay. Well, thank you, Denise. We've just got another one, and it's regarding can you transfer credits from other programs? And if you want, Denise, I can go ahead and take that one.
Sure.
You can transfer up to 9 credits into the program. We have kind of a small form to fill out. There's just a couple little things you want to remember. If you're transferring credits from classes you've taken into this program, the first thing is they can't have been used in terms of another program. So if you have another conferred degree that you're looking to use that, unfortunately we can't take that. It's already been used for one. But basically, if you wanted to do that, we would just need a copy of the syllabi from the course and a little bit of paperwork. And we do this quite often, as long as they match up to what we're looking for the program or course to include. Would you like to touch on that at all, Denise, or did I cover everything?
No, that's great. Yep.
Beautiful. So the next question I got was, why is the CEF accreditation important? And I may defer to you on this one, Denise, just because this is a question we do get quite a bit.
Well, you know, every profession, if they have a special accreditation, you want to get that because, again, it's a peer kind of review process that assures quality in their programming and their design and processes. In this particular case, it's also good because you need it for various positions. Any kind of state or federal position will require CEF accreditation, and they will look at where you come from and what your program has been. So if you're interested in the public health services or CDC or local CDCs, state department, they'll all ask for to make sure that your MPH is from a CEF accredited school.
Okay. Beautiful. So we're kind of wrapping up a little bit here. We've answered most of the questions. We will be sending out an email to all the attendees, basically giving you folks my contact information that we have posted up. That way, if you have questions, you know who to get in contact with. Also, we will be sending a copy of this PowerPoint in the email out to you folks. That way you can review, and if there's any questions that pop up as you look through it, you can, of course, reach out to us. And I think that's all we've had for today, unless, Denise, you have anything else?
No, that's great. We look forward to your application, and have a wonderful day.
Beautiful. Thank you, Denise. You folks have a wonderful night. We look forward to speaking with all of you, and like I said, I will be sending an email out to everyone with the PowerPoint, all my contact information. I would really, really encourage you, any questions you have, please feel free to reach out to me. That is what I'm here for. And you folks enjoy the rest of your night. Thank you for attending.
Bye-bye.
Take care, Denise. Thank you.